Hi, and welcome to our annual membership meeting. I'm very excited tonight to introduce you to some staff members who are going to give some updates on all of the work that we have been doing. I also am really excited to talk about our work over the last year to develop a strategic framework for our work over the next few years. And I am very excited to announce our 2003 board members. We do have incumbent board members who ran for a board seat again and were approved by the board. We also have new board members who are joining us for the very first time. Our process is the board has approved this slate of board members, and at the next board meeting, our board secretary will cast a unanimous vote for these board members. We'd like to welcome them all to the ACLU of DC board. I'm really excited to start our evening off with our strategic framework. Over the last year, the board and staff worked together on the strategic framework, and it was informed by a survey of our members, our donors, our community partners, to really look at what we were doing well, what we could improve, and also how we bake equity into the work that we are doing here at the ACLU of DC. A result of that work is really getting focused on our vision. How do we see DC if we have done our work successfully and in partnership with the communities that we serve? And we really articulated how we do that work here in the district as the ACLU that really preserves, protects, and defends these civil liberties and civil rights. While developing our vision and our mission, we baked some assumptions into this work. We know that our achievements are not just our own. We acknowledge the communities we serve, our donors, our members, and celebrate together when we have achievements. We understand that building relationships and coalitions, education and community outreach require a coordinated and multi-pronged approach to integrated advocacy. We know that doing our work through an anti-racist lens is rooted in dismantling white supremacy and anti-Blackness. And it is through this that we understand overhauling policies and systems that deprive people of their civil liberties and civil rights requires the long game and keeping our eye on the ball while still doing the progressive and incremental changes that pave the way to lasting progress and help us achieve our vision. We are going to do this through our key priorities here in the District of Columbia. These are the things that we as the ACLU of DC can focus on and really have an impact on. We fundamentally believe that the key to unlocking civil rights and civil liberties for the over 700,000 residents of DC is achieving statehood. We also know that in the protest capital of the nation, our First Amendment rights are incredibly important. And we remember that there are actually 6 parts to our First Amendment. Freedom from discrimination. We work to dismantle systemic inequality and remove barriers in order for people to realize their full potential and dignity and ensure the promises of the Constitution and Bill of Rights actually apply equitably, equally to all of us. And then criminal legal reform. This has been a core part of the ACLU of DC's work over the last few years and continues to be so as we move into the future. But how will we know if we have an impact? Our impact on DC should show that we are a leading advocate for civil rights and civil liberties in the district, that we provide accessible and trustworthy legal and political expertise on these issues, that we achieve outcomes that produce concrete changes in the lives of our community members and enables them to exercise their rights and ameliorates and eventually ends oppressive conditions and practices that they experience. And our results will show that our communities will be educated and engaged in our efforts, that our membership will play a crucial role in helping us achieve these objectives, that our communities will trust the ACLU of DC, both in our short-term goals and our long-term goals. And our endeavor will support DC residents in achieving self-determination. There are many more results that we have, but we hope that you join us in our work, engage in opportunities, and continue being supporters of the ACLU.
Good evening. My name is Damon King, and I'm the Policy Director here at the ACLU of the District of Columbia. I'm pleased to talk to you this evening about our policy work. The year so far has been a busy one, beginning with 2 campaigns to fight back against congressional interference in the district's efforts to make key criminal justice policy reforms. First, in the early part of the year, Congress took aim at district legislation to rewrite the district's criminal code. Then, in March, Congress again took up a disapproval resolution against comprehensive policing reform legislation aimed at improving transparency, holding police accountable when they break the law, and restricting harmful practices that have led to severe harm and even death. In opposing these disapproval resolutions, we worked closely with local and national partners to ensure that Congress had correct information about these bills. While we were not successful in preventing congressional disapproval of criminal code reform, we successfully advocated for President Biden to veto the congressional resolution that sought to overturn DC's police accountability legislation. We also continued our efforts to hold district agencies accountable, oppose legislation that would enact harmful changes to the district's criminal laws, and support legislation aimed at addressing problems in the district's criminal justice system. Our efforts have included testifying at the Council's oversight and budget hearings for the Metropolitan Police Department, where we urged the Council to take steps to improve transparency regarding police practices and to take a more comprehensive approach to public safety, particularly with regard to young people in schools. Testifying at oversight and budget hearings for the Department of Corrections, urging the Council to fund legislation that would improve oversight of DOC facilities. Testifying against legislation proposed by the mayor that would, among other things, expand pretrial detention and sentencing enhancements. And testifying in support of legislation intended to improve food and nutrition at DOC facilities. Further, in coalition with a number of community partners, this spring we launched a crisis response policy platform, which includes a series of recommendations to reform how the district responds to individuals experiencing mental health crises. Since the platform's launch, we have been meeting with DC Council staff about opportunities to move the recommendations forward, including opportunities to pass some of them in the form of legislation. Now, as we approach the end of the year, the ACLU of DC will continue to oppose harmful criminal justice legislation and to advocate for a more comprehensive approach to public safety. We will continue to advocate for interventions built around offering trained and appropriate responders to meet people's safety needs. And we will fight against the continued over-reliance on policing and harsh sentencing laws to arrest and incarcerate our way out of the challenges we face. Thank you for the opportunity to speak with you this evening.
Hello, my name is Maxine Davis and I'm the organizing director. This time last year, our department was just about to be formed, and we are so excited to have a new department to better mobilize, educate, and empower our community into action, to continue to protect and expand our civil rights and civil liberties. We've been working to overhaul the district's crisis response to center a more public health and human-centered approach to engaging with DC residents when experiencing a mental health crisis through our crisis response campaign and coalition, which you'll hear more about shortly. We've been organizing to make DC the 51st state, to protect home rule and remind Congress to keep their hands off of DC. We've been supporting Court Watch DC in collaboration with Harriet's Wildest Dreams because we believe injustice happens in empty courtrooms, and we must be present to document the district's policies and actions and hold our judicial actors accountable. We have also hosted several Know Your Rights trainings to various community groups across the district, held skill shares on storytelling, effective one-on-ones, and more. And you might have even seen us tabling at the Pride Festival, 8th Street Market, Adams Morgan Day, or any of the other many community events that we've been to this year. We would love to have you one day, and we are always looking for more people just like you to continue to build power and possibility in DC.
Good evening. I'm Scott Michelman, Legal Director of the ACLU of the District of Columbia, and I'm so happy to be with you here tonight to tell you a little bit about our legal docket, how we're protecting civil rights and civil liberties here in the District of Columbia. First, a brief overview of what we have on the docket. Our docket, as you can see by this graphic, has about 40 to 45 active cases and a number of other non-litigation advocacy projects and some significant investigations. This is slightly smaller than it was when I spoke to you last year at this time, and that's because we've been trying to focus on smaller but more, on a smaller number of larger, more significant cases. And I hope you'll see that carried through as I describe some of the cases on our docket. So the first area I'd like to talk about is free speech, always a huge part of our docket and a strategic priority. Our free speech work centers on protest, and I'd like to mention two cases where we're fighting for justice for protesters. They both arose out of incidents on the very same night, June 1st, 2020, at the height of the George Floyd protests here in our nation's capital, when officials of the Trump administration attacked protesters on multiple fronts at multiple places. We are still fighting for justice for the Lafayette Square protesters, the racial justice protesters right outside the White House who were tear gassed, beaten, and driven by force from Lafayette Square when they were trying to bring their nonviolent message of anti-police brutality and racial justice to the ears of our nation's chief executive. We have achieved some policy reforms of the Park Police and Secret Service in that case, but we continue to fight for damages. There was a setback earlier this summer when we lost at the DC Circuit our bid to overturn the dismissal of our constitutional claims, but there are other claims we can still pursue for damages on behalf of the class of protesters who were attacked that night in violation of some of our nation's most fundamental values. Also that night, we had a protest get broken up near Chinatown by two National Guard military helicopters that flew low over protesters using a military-style tactic that's generally used for crowd control in war zones, not for peaceful domestic political protests. And so we represent one of the demonstrators who suffered great trauma, as well as debris stinging her eyes and face when the helicopter whipped up tropical storm force winds while she was protesting in the nation's capital. And we filed that case earlier this year. Turning now to criminal justice reform, we were just in court last week in the DC Circuit where we argued an appeal to revive our claims about the DC police practice of maintaining arrestees' cell phones long after any need for that property has ended. So the police will confiscate people's phones when they arrest them, as well as sometimes other valuable property, hold them thinking they might search them in the future, but never get a warrant and hold on to them for months or even years, as happened to our client, even when they ask for them back. We're fighting to have that practice halted. Also in the criminal justice reform area, I'm pleased to report a victory, at least a preliminary one, in our case about kosher meals at the jail, where Jewish individuals in custody were denied religious accommodations to eat kosher meals because they could not provide proof to DOC satisfaction of their Judaism through a letter, for instance, from a rabbi. Just weeks after we sued on behalf of a Jew in custody who was denied his meals, DOC started providing the meals and changed its policy. We continue to fight for damages and also to ensure proper enforcement of the new policy. Now for a case that bridges the gap between or bridges between our areas of criminal justice reform and anti-discrimination, two of our strategic priorities, our crisis response case, one of our biggest cases, which we filed earlier in 2023, is a case designed to replace police as the primary first responders to people in mental health crisis with trained mental health professionals, as experts and the federal government have recommended. This case is in its initial stages, but we will be fighting for major structural change here to get the police out of the business of being the first responders to these crises, where they often aggravate them or heap criminal justice consequences on people already suffering a crisis, people who need medical or mental health intervention, not a police response. That brings us to anti-discrimination, a third strategic priority, where in addition to that case, we're also continuing to fight for Sergeant Dion Jones of the Department of Corrections, who faced terrible harassment because of his sexual orientation, and trying to change the culture there and fight for justice for Sergeant Jones. Finally, in the immigration area, one where we partner with our colleagues in the National ACLU frequently, I'm pleased to announce the end of the Title 42 border restrictions that use the COVID pandemic as an excuse to turn people away from the southern border for approximately 3 years. But the bad news is the Biden administration has now resurrected some of the worst asylum restrictions of the Trump administration. And so we are back in court challenging those. And so we will persist in fighting for immigrants' rights. And my general theme is always the battle for civil liberties never stays won. So we're so glad you're here with us tonight, continuing to give us your support so we can fight for our most fundamental of rights.
Good evening, everyone. My name is Maxine Davis, and I'm the organizing director here at the ACLU of DC. I'm going to talk to you a little bit about the significance of the crisis response campaign in the district. So DC residents deserve safe and equal treatment, whether they have a disability or not. And our current crisis response system in DC fails to provide adequate care to people with mental health disabilities, resulting in involuntary hospitalization, unnecessary injuries, and trauma. So we need the district to invest more in an effective and compassionate crisis response system that centers public health and not police. No one would call a cop to treat a heart attack, but that's what we do. That's what we do with mental health. We respond to a mental health crisis with police, which is like calling a letter carrier to respond to a fighter. It's the wrong government employee for the wrong job. And we know that 84% of Americans agree that a person having a mental or behavioral health crisis should be treated by a healthcare provider or crisis counselor, not by police. Police are trained for mental health emergencies, and so they're not well equipped to assess or respond to the needs of people in crisis. Yet in DC, they are often the first and only response to calls for help. And the district mental health care system is failing more than 129,000 residents in DC with mental health disabilities. Instead of relying on police, DC needs to invest in effective solutions that provide DC residents during mental health crisis with someone to talk to, someone to respond, and somewhere to go.
I'm Scott Michelman, our legal director, and I'm here along with Maxine to talk about our crisis response, about the legal aspects of our crisis response campaign, including our lawsuit. As Maxine said, when people in DC call 911 for a mental health emergency, it's generally an MPD officer, a police officer who responds. And MPD training and policies make it more likely that officers will exacerbate mental health emergencies than ameliorate them. Indeed, mental health professionals report that officers in DC rarely respond to crises in medically appropriate ways, and sometimes officers use unnecessary force against people in crisis. National and local experts, including the Federal Substance Abuse and Mental Health Services Administration and the National Alliance on Mental Illness, have concluded that reliance on police to address mental health crises is more likely to harm rather than help the mental health issue. Accordingly, they recommend that communities invest in mental health providers to handle such emergencies. In DC, during fiscal year 2022, less than 1% of 911 calls classified as mental health emergencies got a response from mental health clinicians and peer support specialists. In contrast, during the same year, 90% of 911 calls related to physical health emergencies got a response from an EMT or paramedic. Understaffing in the crisis response teams has resulted in response times in DC ranging from 1 to 3 hours compared to a benchmark of just 5 minutes for EMT response or 9 minutes for paramedic response. We've sued because the district's reliance on police as its default responders is not only unfair and unsafe, but also unlawful. Federal disability law prohibits governments from depriving people with disabilities of equal access to emergency services. Employing medics for physical health care crises, but police for mental health ones does just that, violating federal law. Bread for the City, a DC nonprofit that serves under-resourced community members, sued the district, and we represent them along with the law firm of Shepard Mullen and our colleagues at the National ACLU. Sued the district to rectify this injustice, demanding parity between emergency services provided to physical and mental health emergencies. And so we filed that case earlier this year, and now the district has responded. So we're in preliminary motions practice where the district gets to make legal arguments trying to get rid of our case. Meanwhile, the police union is also trying to intervene in the case. So we'll have a lot of fights to come, but we are in this for the long haul alongside our partners in policy and organizing. We are hoping through a combination of the litigation and legislation and power building through community organizing to transform the system of crisis response here in DC. And now we welcome your questions.
It looks like we have some in the chat already, Scott, so I'm going to get started with those. The first one up is, what would an effective and appropriate crisis response look like in DC? So that really goes back to making sure that we have someone to talk to, someone to respond, and somewhere to go when a DC resident is experiencing a mental health crisis. So when we're thinking about someone to talk to, DC has alternative crisis call centers, but most people still call 911, and 911 dispatches MPD to most calls. DC must promote alternative numbers to 911 and provide 911 operators the resources and training to address more appropriately these calls that are coming in. And for someone to respond, local mental health professionals want to call CRTs and other similar programs for youth to address crises, but they can't rely on those services because it takes hours for non-police responders to arrive. So DC needs to devote more resources for mental health specialists to provide timely responses to mental health crises so they can be the default frontline responders instead of police. And when we're thinking about somewhere to go, the Substance Abuse and Mental Health Service Administration estimates that only 14% of mental health emergencies require treatment in an emergency room, and most important, appropriately resolved in a community-based facility. But DC doesn't have enough of these facilities. DC must create more and ensure that people can get adequate long-term community-based care once a crisis is addressed.
So I'm also seeing a question, what does the ACLU DC hope to achieve with the lawsuit against the district? We are seeking injunctive relief, that is a court order, telling DC that it can no longer rely on police as the primary first responders. Rather, a mental health emergency requires a mental health response in order to cease discriminating against people with disabilities, such as the most of the population who's going to be having those mental health emergencies for which DC is usually sending police.
My next question is, can you highlight specific incidences that underscore the need for immediate reform? So we at the ACLU of DC have been speaking with community members on their experiences engaging with law enforcement, whether or not it's themselves or a loved one that has experienced a mental health crisis. One community member shared with us that their neighbor called 911 during a domestic dispute from a past abusive partner. The community member was awakened by officers knocking at their door, and she repeatedly asked for police to remove their partner from the apartment, but was instead carried out and sent to emergency psychiatric service. This incident is one of many that shows how harmful and more traumatizing police interactions can be. Relying on police as a de facto response system is unacceptable and unsafe because even well-intentioned law enforcement can still escalate a crisis just by being police. This puts both residents and officers at risk of harm and constitutes a fundamental misuse of law enforcement resources.
So another question that I see is, why are we trying to reform the district's crisis response system? It's really about the people who are harmed by the system. It's about people who are mistreated, who end up with criminal consequences, who end up facing violence at the hands of the police when a trained mental health professional could provide a more appropriate response. There's a huge myth that we're trying to combat through our efforts about people with mental health disabilities or experiencing mental health crises. And that myth is that these folks are dangerous and that only the police can handle them. And in fact, the statistics bear out the opposite. In fact, close to nearly all of the mental health crises to which the DC's police have responded with the small group of officers they have that they have provided some training to respond are unarmed. And so this notion that mental health crisis equals threat is a key assumption, but misunderstanding underlying the current system. And we have to change people's understanding, rely on data and expert recommendations so that people get the help they need rather than a violent response. And Maxine, did you want to add to that?
I think you got it, Scott. Thank you.
All right, I think the next question is yours.
I sure can take it. Someone asked how can you get involved in the crisis reform effort? If you are the slightest bit impassioned as I am about this, there are so many ways that we could use your support. And the best way to do that is to stay connected with us and sign our commitment card, which you can find on our website at dccrisisresponse.org. And you will be able to get all of the up-to-dates of how we are moving through our campaign work, how you can get involved, whether or not that's coming out to testify, coming to an event, or just really just wanting to know how we're moving through the work. And we always want to make sure that you are able to bring your friends and family along in this journey, because we need to build people power around this, and we need your support to do that.
So I'm seeing another question about the budget. Is this a budget issue? What would it cost to provide appropriate responders, and who would they be? Well, one of the surprising assertions that DC has made so far in this lawsuit is that we're asking for a new service to be provided. DC already has a mental health system, and it even has a little bit of training and a small group of crisis response teams. The problem is the ratio is completely backwards. Most of the 911 calls, which all go through an Office of Unified Communications, it's actually the name of it, the DC Office of Unified Communications, most of those calls receive a police response, over 90%, whereas a very small fraction receive the trained mental health professionals. We want to reverse that. We think that it's a matter of scaling up the crisis response team that are trained to handle individuals and situations involving mental health crises, and scale back and redirect law enforcement resources so that they're not involved in doing a job that they're not well equipped to do, and that they are actually actively ill-equipped to do through training that teaches them to command and control situations where a person in mental health crisis might need a much more de-escalatory response. And so part of the issue is not about the amount of money. It's really about where we're spending money and reallocating the resources so that the ratio of who responds can ultimately change.
So we have some more questions that shift us a little bit away from crisis response, but that's all good. We're taking all your questions today. So that says, what is your plan to educate and organize against Councilmember Pinto's public safety amendments that will allow police to stop and frisk persons who have been convicted of gun charges? So we are reviewing the package of bills that Councilmember Pinto introduced just last week. We've been speaking with partners to ensure we have full analysis to share with communities to mobilize in opposition to provisions within the bills that impact people's civil liberties and rights. So please stay tuned, and we will be calling on you soon to support our efforts.
One more crisis response question I see is, so is the problem with 911? It is and it isn't. The problem, I mean, part of the problem is all the calls go into 911, and some of the operators need to be trained to reroute the mental health emergency calls to trained crisis response teams as opposed to the police. But part of it is who's available to respond. So it can't just be that everyone floods 911 with their mental health calls and there are just not enough people to respond, which is the current situation. So ultimately, the federal recommendations, the expert recommendations that we're relying on, emphasize someone to call, which there is, but they don't necessarily know what to do. Someone to respond, which needs to be the right person to respond, and somewhere to go in a crisis. And we need to have more options for people in crisis to find a safe space to go. So 911 is part of the problem, but not the whole problem. Looking now at answered at open questions, or Maxine, did you Do you
Yeah,
see a new one to take?
There's a question in here on statehood. So it says, how is ACLU DC hoping to advocate for DC statehood in the future? And does it include congressional lobbying? So we are the ACLU of DC and the DC affiliate of a national organization with affiliates in all 51 states and Puerto Rico. And so we are partnering with our national office and ACLU members in all states to learn about statehood and mobilize them to urge their congressional members to give DC statehood. And we are going to continue our fight when Congress intervenes in DC autonomy and making sure that we can maintain home rule in DC. So we've been working with the Hands Off DC Coalition to stop Congress from interfering in DC's basic right to self-govern. And so you can take action there at handsoffdc.com.
And I should add that it's a real irony of this situation that DC residents lack the tools to achieve statehood because they lack statehood. It's a classic catch-22. We need the representation in Congress in order to pass the bill that would make DC a state to get representation in Congress. So we have to rely on and really educate and mobilize people all over the country to urge their representatives to fight for our rights, so that we are then better positioned to stand up for our own with political power in our national legislature, which we currently don't have.
I don't know if I'm seeing any more questions there, Scott.
I am not either. Unless there are others, does that conclude our program, or is there a wrap up by somebody? Hearing going once, going twice. Okay. Well, thank you all for I see a question in the chat. How is DC using the NEAR Act to pressure the DC administration to provide mental health workers? That's one I don't know. I can tell. No. I can tell you that we have been relying on the NEAR Act data to document how DC Police's program of stop and frisk disproportionately affects Black residents of the district, and results in what we think are, and hear from community members all the time, are countless unconstitutional stops and frisks, which are violations of the Fourth Amendment, and that is also something that we hope to be addressing. But that is the main sort of our main involvement in the NEAR Act. So if there are no other questions, I just want to thank everyone for your participation and attendance here tonight. And I hope you will continue to stand with us as we fight for the entire range of civil rights and civil liberties here in the District of Columbia, including our 4 strategic priorities: statehood, the First Amendment, anti-discrimination, and criminal justice reform. Thank you very much, and good night.
I want to thank all of you again for joining us this evening. Thank you and welcome to all of the board members who are starting their new terms. Thank you to the staff for updating us on the work we have accomplished and some of the work we are in the midst of. And we hope all of you will join us as members of the ACLU of DC to volunteer and engage in helping us accomplish our goals for a free and just DC. Thank you so much.